Hello, and welcome to the UCSF New Patient Orientation for Obstetric Services. Congratulations, and thank you for choosing UCSF to help care for you and your growing family. I am Irene Flores, the Patient Navigator for Obstetric Services. I'm available to help coordinate any part of your care and navigate your experience of delivering your baby here at UCSF. Feel free to contact me for any of your needs. There are several locations to choose from for your prenatal care. These include UCSF Mission Bay, Owen Street, Mount Zion, and Saramonte. If you have any specific concerns or would like to schedule an appointment, please call our main OB line 415-353-2566. If you are not a patient of UCSF already, at the time of your first prenatal appointment, you'll be given an access code to sign up for MyChart, a great online secure communication portal to get your questions answered and view lab results. We highly encourage you to sign up. Also, at the first visit, you'll be given an OB guidebook, Caring for Yourself During Pregnancy. This book has an abundance of helpful resources and education to assist you through your journey. UCSF Team-Based Philosophy Group Practice Model. We truly work as a team. You might see a number of different providers throughout your pregnancy, and we all have one goal: for you to have a healthy baby. This is an appointment with a licensed clinical social worker where your needs are addressed, whether it's mental health related, needing additional resources, or just extra emotional support. We offer these appointments both at Mount Zion and Mission Bay. We also have a dedicated OB psychiatrist should you need a higher level of care. This is a UCSF resource for a variety of pre- and postnatal needs. The Great Expectations Pregnancy Program offers prenatal, postpartum classes, support groups, birth center tours, and items to purchase for all your nursing needs. The WHRC is located at Mount Zion and Mission Bay. For more information, you can call 415-514-2670. We have a number of inpatient and outpatient lactation consultants available, as well as a popular support group called MILK. All forms of genetic testing, counseling, and formal ultrasounds will be done through the PDC. Although PDC appointments are related to your pregnancy, they are different from routine prenatal visits. Antenatal testing is used to evaluate fetal well-being in certain pregnancies. Providers may recommend this testing for some patients to obtain more information about how the placenta is functioning and to provide an overall assessment of your baby in the final stages of pregnancy. Your EDD, estimated due date. It's never perfect. This can be 40 weeks from the first day of your last menstrual period or 38 weeks from conception, usually determined by your last menstrual period, but sometimes based on ultrasound or an IVF date. Babies usually deliver between 3 weeks before and 1 week after your EDD. The timing of many aspects of your prenatal care are based on your EDD. First trimester, conception through 13 weeks. Second trimester, 13 weeks through 26 weeks. Third trimester, 26 weeks to delivery. Your new OB visit will be a longer appointment with one of our midwives or NPs. You will be given information about our services and what to expect. The provider will review your medical history and complete a physical during this visit. Based on your preference and clinical needs, we will make recommendations as to which provider would be the best fit for you. We will establish your EDD, confirm that the pregnancy is developing normally. There will likely be a bedside sonogram done to ensure this. Routine blood tests are asked of every patient. Initial genetic evaluation if desired. Continued genetic evaluation if desired. Fetal ultrasound. This formal ultrasound ensures that your baby is developing normally. We usually can determine the sex of your baby as well. Testing for diabetes in pregnancy or gestational diabetes. This will require a glucose test. When the time comes, you will be given your detailed instructions on how to get this done. Please note that if you test positive for gestational diabetes, we have a very supportive program called Diabetes in Pregnancy Program, in which you will be closely monitored during your prenatal care. We will remind you to sign up for prenatal classes if desired. Planning for labor and delivery. Antenatal testing is additional monitoring for mom and baby closer to delivery if recommended by an OB provider. You will be asked to go to antenatal testing either 1 to 2 times per week. Not all women will need this. The third trimester is when it's recommended to take the birth center tour. You can view the tour online or join an in-person tour. Sign up early as they fill up quickly. Testing for group beta streptococcus. This is not an infection. This is a bacteria that lives in our gut and is not harmful to mom or baby before labor. About 20% of women will test positive, and this is normal. We will need to treat you during labor to prevent any infections for your baby during delivery. At the time of labor and admittance, your care team will be introduced to you. This team will consist of 3 main people: a primary nurse, an OB provider who can either be one of our certified nurse midwives or MDs, and a resident doctor. Now let's review some common first trimester symptoms. Please refer to your OB guidebooks for common discomforts during pregnancy and treatment options to help maintain these symptoms. You will also find a list of medications to take during pregnancy and breastfeeding. For nausea and vomiting, we recommend frequent small snacks to keep your blood sugar stable. Ginger products are helpful, and vitamin B6 and Unisom in combination. For constipation, a high-fiber diet and lots of water for hydration. For fatigue, take frequent naps and warm baths before bed. For cramping, minor cramping is normal. However, please call us if you feel pain. For nutrition, you will find a very detailed food safety guideline for pregnancy in your OB guidebook. For exercise, if you have a routine you are used to, it is completely fine to continue this. Stay hydrated and take frequent breaks while exercising. The information in this presentation is meant to guide you as you make decisions about what, if any, testing is best for your family and pregnancy. We would like to emphasize that most pregnancies result in a healthy baby. Genetic counselors are available to you through our prenatal diagnosis center located at Mission Bay. An important conversation you will have at your first OB visit will be whether you want to obtain information about genetic health. There are options to test for genetic problems that may affect the baby's health. These may be conditions inherited through the family or new conditions that occur in the fetus. Some families want this information, others don't. Genetic testing is always optional. Our genetic counselors will help decide what, if any, testing is most appropriate depending on your history. Risk for chromosomal abnormalities increases with the mother's age. Abnormalities occur when the wrong amount of DNA is passed down to the fetus. One of the most common chromosomal abnormalities is Down syndrome. Screening tests identify your chance of having a baby with certain genetic conditions. Typically, these tests look for select few conditions and give you a risk assessment. Diagnostic tests indicate if the baby is affected or not affected with a specific birth defect, including Down syndrome. All patients will be offered the California prenatal screening, which includes 2 blood draws, 1 in your first trimester, 1 in your second trimester, and an NT ultrasound. A measurement of the fluid that collects behind the fetus's neck. Measured by ultrasound between 11 and 14 weeks of pregnancy. This is a specialized ultrasound that is performed in the prenatal diagnosis center. NT is combined with your blood test results to provide you with a risk for Down syndrome and trisomy 18. More fluid indicates a greater risk of an abnormality. If this is the case, it can be associated with other birth defects, cardiac defects, and genetic syndromes. In the second trimester, these risks are revisited using markers from another blood draw. Prenatal diagnostic tests can identify if the baby is affected or not affected with a specific chromosomal condition, such as Down syndrome. These are invasive options that are associated with the risk of pregnancy loss. These options include CVS, chorionic villus sampling, which involves taking a tiny piece of your placenta tissue. Amniocentesis is removing a small amount of your amniotic fluid. It's important to remember that all screening and diagnostic tests are optional. If you have any questions or need clarification, feel free to get in contact with one of our genetic counselors to help make the best decision for you and your family. It's important to know what your ethnic background is and understand where your ancestors came from. Certain genetic disorders are more common in certain ethnic backgrounds. Carrier screening is offered to one or both parents before or during a pregnancy. The screening involves obtaining a blood sample from one or both parents to identify carriers. Parents who are carriers of a genetic condition do not typically have the disease themselves, but do have an increased chance of having affected children. Many conditions are inherited only if the mother and father are both carriers. If you have more questions, call the Prenatal Diagnosis Center to make an appointment.
The UCSF centering program really just kind of showed me that it's okay to be a young mother.
They have alleviated a ton of anxiety for me. That was something that I struggled with.
Being a new mom can be an isolating experience, and big role of prenatal care is to help support women through their pregnancies, and centering provides a forum for which women get lots of support.
UCSF centering program is pretty much an alternative way for pregnant women receiving their prenatal care here at UCSF to do it in a different fashion, taking outside of the exam room.
So centering is for all women, for anyone who is pregnant, who wants to learn more about their pregnancy, about labor, about delivery, and who wishes to do it in conjunction with other women.
We know that continuity of care is better, to be able to see the same person all the time, because there's so many things that people might share that they wouldn't necessarily share in a 15-minute appointment when they've never met you before. It's so much more holistic when you're in a group. You have so much more time, and we're talking about a 2-hour visit as opposed to a maybe, if you're lucky, 15-minute visit.
Over and over again, in several studies that have shown that women are much happier with centering care. And in one particular study, really looked at a decrease in preterm birth. That is fantastic.
What interested me most about the centering program was that there would be moms who had babies already, who were first-time moms like me. Having those resources really appealed to me.
The goal for centering pregnancy is basically to provide quality care, but also to recognize the fact that we don't have all the answers. It's really kind of a understanding that there's a lot of knowledge that comes from the community.
Patients actually provide most of their education themselves, and centering is this incredible opportunity where they educate each other and they form this tremendous community. In the end, I think I learned more from my patients than they learned from me.
No matter who you are, whether you're a patient, you're a partner, you're the facilitator, you're the co-facilitator, we're all equal. I think that is the magic of centering.
Having that sort of community support, that we're all mothers, we're all going through the same exact thing, we're all gonna be in labor. So it was kind of nice just to have that support system behind me and just, yeah, you can do it, and it's okay to be nervous, it's okay to be scared.
My hope is to actually be able to touch the lives of these new parents on their journey through parenthood.
I hope that this model of care, centering pregnancy, is looked at by many more patients, and that we can actually recruit many more patients into our program.
Thank you for choosing UCSF to care for you and your growing family.